The TAC has a very broad research portfolio. We invest in road safety research, health, disability, compensation systems, client experience and client outcomes research. In 1999, the Victorian Trauma Foundation was established with major funding from the TAC, and the purpose of that was really to reduce mortality for those injured on our roads. In 2005, we established the Victorian Neurotrauma Institute in conjunction with government partners, and that really had a focus on research into acquired brain injury and spinal cord injury. That then transitioned into the establishment of the Institute of Safety, Compensation and Recovery Research, or ISCA, which is a tripartite agreement between the TAC, WorkSafe Victoria and Monash University. We've also been a long-term funder of the Longitudinal Head Injury Outcomes Study, and that has follow-up of patients for over 20 years now.
So POLAR is a randomised controlled trial which is designed to try and improve outcome for patients with severe brain injury after trauma. To achieve a trial like that of 500 patients, randomised into two groups, patients enrolled at all the major cities in Australia and a number of countries overseas, is quite a big process. So the idea of POLAR was to use several methods that we have to start cooling very, very early, and then to continue it for a longer period of time than other people had done before, up until 3 days after the trauma had happened, and then to reduce the cooling back up to normal in a very slow, controlled way so that there weren't any side effects. So the TAC's support was critical. We wouldn't have been able to complete as we are now going to without it. These trials are changing the way we manage patients already, and they're certainly changing the way we learn about head injury into the future. If cooling the brain using this system starting early, which is a method we can clearly apply everywhere, if that improves patients' survival and function, then it would become standard practice across the world. And the goal of that would be to improve people's capacity to live independently in the long run.
A number of years ago we undertook a qualitative study. We looked at some really in-depth interviews of patients to see what their experiences were with being managed in the trauma system. And one of the most overwhelming aspects that came out of that research was that patients felt that the discharge from hospital wasn't really well planned for them. They weren't really engaged in that process. So the MERRCs are the Major Trauma Recovery Coordinators, and we've managed to receive funding from the TAC to put two of them in place at the Epworth Hospital. And really their role is to try and work with the patients during their hospital stay, help facilitate their discharge planning, keep them informed along the way. Around 40% of our major trauma patients in Victoria are actually TAC clients, and a lot of the patients were saying they were having a lot of trouble accessing the TAC. They were getting a different person every time that they called, and so the MERRCs are sort of liaising better with the TAC, and we've specifically designed the role, and the TAC has worked with us to make sure that there are channels for communication between the MERRCs and the TAC to really sort of facilitate the delivery of services to the patients that need them most. The research side of it really is evaluating what happens with those. So why do patients call them? What do they need? Are they still having unmet needs? What are their experiences with the major trauma recovery coordinators? And ultimately finding out whether the patients who are managed by these care coordinators actually do much better in the long term. There really isn't equivalence elsewhere. You may occasionally see aspects of the role taken up by some clinicians at some centres around the world, but I think this is really probably the first attempt that we've made to really sort of create a cohesive post-discharge coordination role, and I think that it's a good test and it will be a good model for the future.
The TAC invests in world-leading trauma research so that we can deliver better outcomes to our clients who've been injured on roads and help them get their lives back on track. TAC is really committed to improving the trauma system, and we've partly done that through our investment in the Victorian State Trauma Registry and supporting projects that have come out of that registry.